This is a Dutch testing report tutorial. These tutorials are intended to be for educational information only, to assist you in understanding and interpreting results, but not intended to be any sort of medical advice. The results that we actually show on the screen are generic, so not a particular patient's actual results. There's a lot of data for us to look at with respect to cortisol. Of primary importance would be the pattern of free cortisol as it potentially changes throughout the day. The first sample being from the waking sample, which it's a waking sample, but it reflects the free cortisol during the sleeping period for the patient. The morning sample then represents the first 2 hours of the day, where there's expected to be a surge of cortisol, which then comes back down by the afternoon, and then the lowest value is typically that bedtime sample. So that's the free cortisol. We're measuring the individual points, and then we add those up to give this marker here. So that's a calculated value that gives you an idea of the total of free cortisol throughout the day. And that's important because it tells you what cortisol is circulating and able to get into the cells and do what cortisol does. What it is not is it's not a marker for total output of cortisol by the gland, by the adrenal gland. For that, we've got a better marker, and that is metabolized cortisol. So the metabolites of cortisol really tell us better the total cortisol production. So in this particular case, the free cortisol is on the low side, and then when we look at the total cortisol production, it confirms that story that yes, there's a somewhat of a deficiency in terms of the total output of cortisol. So in many cases, you'll see the free cortisol be low and the production of the metabolites be significantly higher, which changes the clinical picture in terms of what's going on. In this case, we have a fairly consistent story. So you're going to want to look at that cortisol pattern in terms of the actual cortisol pattern of going up and down as it's expected throughout the day or not, but then also the overall levels, which in this case are a bit on the low side. So when cortisol is made by the adrenal gland, it circulates and interconverts with its inactive form called cortisone. So some compartments of the body like to shift it over to cortisone. Some parts of the body, like the liver and fat cells, like to shift it back towards cortisol. There's an enzyme that mediates that interconversion called 11-beta-HSD, which is depicted by this two-way arrow down here. So the cortisol is going back and forth in its free active form and its free inactive form, and because it spends sometimes a fair amount of time in its inactive state, we also want to look at the free cortisone pattern throughout the day. It's of secondary importance to the free cortisol pattern, but it can help to confirm what's going on. So in this case, you've got a low free cortisol overall, and the cortisone can either confirm that or potentially contradict that a little bit. If the patient's free cortisol status is potentially a little bit higher, you might see that a little bit in the cortisone. So we've got the free cortisol going back and forth, active, inactive, and then they both can get metabolized to the end product, which is the combination. The metabolized cortisol is the combination of both the cortisol and the cortisone metabolites, and that's an irreversible reaction. So once it goes to the metabolites, it's just ready for excretion. So in some cases where you see the low free cortisol, as you see here, and instead of seeing low cortisol production, if you see much higher production, then that's to a degree a picture of increased cortisol and cortisone metabolism, which you'll see in cases of obesity, increased thyroid, long-term exposure to elevated cortisol or similar medications. And in some cases, you'll see the opposite, where the free cortisol is higher in a general sense than the cortisol production, than the metabolized cortisol, which is a picture of somewhat sluggish, potentially, cortisol and cortisone metabolism. And you'll see that oftentimes in low thyroid or poor liver function. So we want to evaluate all of those things, the free cortisol over time, also checking the cortisone, and then the total production. Now, when we want to look for an overall preference in terms of whether there's potentially an imbalance of the cortisol really staying in its active form and maybe being overactive, or being over deactivated, so being deactivated excessively. When we want to ask that question, we don't want to look at the free cortisol and cortisone as much. We want to look at the metabolites, because the free hormone only represents about 1%. Whereas the metabolites represent about 75%. So if we look at that, we get a better idea of the overall preference of either the active cortisol or the inactive cortisone. In a case like this, where the overall cortisol picture is low, if that favors more of cortisol, that might be seen as more of a mechanism of the body sort of trying to hold on to that low level of cortisol so that it's not readily deactivated, and that might make sense in somebody who's got low levels overall. On the other hand, if there's more of a preference to push that cortisol away towards the cortisone, then it might be contributing to some of the low cortisol symptoms of not only is there a low production overall, but if there's also a heavy deactivation towards the inactive form, cortisone, then that may exacerbate low cortisol symptoms. So you want to look at the overall picture of course, the clinical picture, the free cortisol over time, the total production, and any metabolic preference that there might be. So I hope that's been helpful. If you have more questions on this, we have other educational videos on DutchTest.com from a patient perspective. If you have questions, please allow your healthcare provider to field those, and we thank you for testing with us.